The rotator cuff is a broad, flat group of tendons that come from the wing bone to wrap around the ball of the shoulder joint, which doctors call the head of the humerus. They pull this ball into its socket and keep it centered in that socket with all movements of the shoulder. The rotator cuff also helps us elevate our arm above our head, and this movement is lost when the rotator cuff is not working. When there's a lot of abrasion over years, rotator cuff tears can develop as regions of wear, usually as a coalescence of microscopic tears. Now, these are often partial thickness and can be managed with avoidance of aggravating activities and targeted shoulder stability exercises. However, a full thickness tear can occur when this process continues for a long time. Acute full thickness tears are usually caused by severe trauma to the shoulder, and these usually need to be repaired to restore shoulder function. When a patient presents with a painful, weak shoulder, the diagnosis of rotator cuff tears are best confirmed with an MRI in corroboration with clinical examination findings, picking up around 85% of clinically relevant tears. As you can see here, sutures with anchors that invest the tendon back to the bony footprint are used surgically. Full thickness tears are any tear that goes from the top through to the bottom of the rotator cuff surface. They can be wide or small, and we can also measure the degree of retraction or how far the tendon ends move apart from each other. One phenomenon that has been difficult to explain is that many older patients have full thickness rotator cuff tears without significant pain. Studies have shown us that as many as 20 to 40% of people over 60 have asymptomatic cuff tears, and about half of those are full thickness. Anatomists believe that a band of tissue that reinforces the region and runs perpendicular to the other tendon fibres, called the rotator cable, can explain how some of the lower demand patients tend to get by fine with these full thickness tears. In younger or higher demand patients, it's important to detect and treat full thickness rotator cuff tears early, because cartilage wear and osteoarthritis of the shoulder will develop if the ball is not well centered in its socket.
I hope you found this video useful. I create these educational videos to help empower patients by allowing them to understand their problem, treatment options, and the expected recovery. Please remember, this lecture is for educational purposes only, does not constitute the giving of medical advice, and no patient-doctor relationship is formed.